Welcome to the Dr. Meade Show. One of the favorite things about my job is listening to patients, and I do it all day long, and it's fascinating. The problem is I only have 5, 10, or 15 minutes, but you know what? I video a lot of my patients, and one of my favorite shows is America's Favorite Videos. So I said, why don't I share these educational videos that I use for my patients and do a whole show on it? So I've picked out, you know, a handful of videos, and we could probably do 10 shows on this. But they emphasize a lot of educational points, and I'll point those out as we go. But please enjoy Meade's favorite orthopedic videos today. So my first one is an 87-year-old, very, very educated, entertaining patient. Do you know how many people come into my office and they go, oh my gosh, I'm 75 years old, I'm too old to have a knee replacement? And I said, there is really no such thing as an age limit. And they said, well, you know, I went to another doctor and he told me I was too old. And I hear this all day long. Patients come in and they say, I'm too young to have a knee replacement. Some come in and they say, no, I'm too old. There's really no age limit. There's just different risks at different ages. Now, there are medical conditions that can preclude you from having an operation, but this is a very, very safe procedure. So somebody that comes in that's 80, 90 years old, I could always find a video of somebody their age. And this is one that I use when my 85 to 90-year-old patients come in. So I want to share this with you. Sit back and enjoy. I have John Kovitch, one of my more entertaining patients here. And he's got 87,000 miles on his knee. And really, I wanted to talk to John today because a lot of my patients who are much younger are skeptical about having a knee replacement as an outpatient. But here's John at 87 years of age that had an outpatient total knee replacement. So I'm going to just ask him a few questions. But first of all, he's entertaining to me because he's a lifetime educator. He's had a fascinating life. He was in the Air Force. He taught ages from youngsters in elementary school through high school and even college. Is that correct, John?
Yes, even to graduate school.
Even to graduate school.
And I taught, like I said, overseas, which was kind of enlightening.
In which countries?
I taught in the Czech Republic, I taught in Romania, I taught in Poland, and I taught in Austria.
That's pretty impressive. And so, why did you wait till 87 to have a knee replacement?
Well, see, the pain finally got to me. But once I decided, the more important role is you've got to trust. The decision is yours, but then the trust has to go to your surgeon and the people that are around you.
And as we're talking, I just want Melissa to zero in on the kneecap of John. He has no space underneath the kneecap. Going up and down stairs, John, couldn't have been fun. Squatting,
No.
The injections stopped working, etc.
Right.
And then the new knee is right there on that side. John, for most of your life, I'm sure many of your peers and friends have had knee surgery. They were in a hospital for several days. When I started 30 years ago, you were in a hospital for a week. Did you have any concern at all about doing this procedure and going home the same morning?
No, because I turned my beliefs and trust over to the physicians and what the procedure I was going to have completed.
And so we've maximized our pain relief now. Historically, we gave everybody a lot of narcotics. Now we use non-narcotic pain medication, and we've limited a lot of the therapy. We sort of let you do your own therapy the first week or two, and then we start and do some therapy afterwards. How did you do from both a pain standpoint and a therapy standpoint?
The pains, I had little or no pain when I left from the procedure. The pain, I don't call it pain, I call it re-stretching the muscles and the ligament into what they did before I had. And one has to stay into that program, the physical therapy program and the exercises you get, if you cut the exercises short, you prolong the treatment.
Correct. And you participated religiously for 6 or 8 weeks after that, and now you're doing it on your own, correct?
Right.
And so we're 3 months after the procedure, correct?
Right.
So,
Yeah, and the thing is that people, I'm of the opinion that okay, so they discharged me from physical therapy. I was the person that says you have to stay on the regimen that they help you.
correct.
Yeah.
And what's nice now is that 3 months, we'll actually never see you back in the office again, but we'll never lose track of you. Our research coordinator will follow you. But this is amazing to me that historically, people at 3 months were not happy. We would follow you for years in the office, but our protocols are such that now we could follow you digitally or with surveys or on the phone. The important thing now is time and exercise, and I think
That's correct.
You're committed to that.
Yeah, that's correct. If you're not committed to that part of your recovery, or you're going to have trouble. You're going to retreat back to some of the problems you've had
Before. Would you have any hesitancy in recommending our rapid recovery outpatient total knee resurfacing to any of your friends? They're calling you to ask for your advice right now. Did you time that?
No, I didn't time. I thought it was the government looking for me because I'm a disabled American veteran. Can't you tell?
Yeah, oh, I can hardly tell.
But it is a problem. Is the mind controls the pain, and if you let one overgrow the other, you're in big trouble.
Any hesitancy in recommending this program to others?
No, I've already recommended it. I even refaxed the sheet with your name on it and stuff. So it's up to them. Yeah.
We have a great team. So anyway, thank you for that information. Other patients will love this. Patients that are half of your age are afraid. And I wanted to have you as an educator give us some feedback. Thank you.
Well, next, I'm moving on to 16 years of age.
You are.
The numbers of my age are in there. They're duplicated. But if you can't figure it out, I teach math on the side.
John, thank you so much. You're a good man. So a couple of take-home points about John. He loves to talk, as you can see. That's why he's a great educator. Take-home points, he's 87. He lived 3 hours away. He drove 3 hours away after 2 hours. At 3 months, we will never see him again, but we'll never lose track of him. So it was just we use that for our elderly patients. So a quick video to whet your appetite on what's coming up is, can robots do your knee surgery? We're going to have a whole show on this, but I took a quick video this week just to whet your appetite. And indeed, people think that, I've had people come to me and say, Dr. Meade, I want you to do the surgery because you use the robot. And I look at them and I said, well, really, that's not a reason to come to me. I said, a reason is that we have done knee replacements, we study knee replacements, we teach knee replacements, we do hundreds and hundreds a year, and the robot is another evolution of a tool that we use. But a robot doesn't make you a better surgeon. It doesn't make a bad surgeon a better surgeon, and you still have to know how to do the procedure. But we're going to talk about that in another show. But let me give you a quick 1-minute video on what this is about. It makes a little noise, but this is so you'll watch our next show.
We're here doing a Mako robotic total knee arthroplasty. The patients have a lot of questions about what robotic surgery is, and I just want to explain in a short video exactly what it is. They think the robot does the surgery. The robot does not do the surgery. The surgeon does the surgery, but this is new technology that helps us do it with extraordinary positions. So I want to show you exactly what robotic surgery is. Now, I'm going to explain it a little bit, and I'm going to do our first cut with the help of the robot. It does make a little noise, so I'm not going to talk while I'm doing cutting. But if you look at the monitor over here, I'm going to look at the monitor. You see a saw blade over there, and there's a saw blade here. The green on the monitor is the bone. So I'm going to cut that green and looking at it while the robot cuts the bone. And you'll see it's a good analogy. It's almost like lawnmower cutting grass, so it's going to cut the green away as I cut it. I'll stop halfway through and just explain what I'm doing. So we're going to get started right now. The robot will come in and allow me to cut. So I'm going to stop talking. Halfway through and I cut half of the lawn, but that's actually the bone, so that is a very precise cut, and that's the ingenuity of the robot. So I'm going to cut the rest of the tibia now, so cover your ears. And that's it, the tibia is cut, so all I have to do is cut the femur now. There's 4 more cuts. But the green lines on the monitor that you saw, those are the borders. You know what? It's almost like anybody that has an electric dog fence at home where the dog can't get out of the yard. Well, the saw can't get out of the border, so it protects all the vital structures like the nerves, the vessels, and the ligaments. So it's a very safe way to do the surgery. So that explains it. I'm just going to finish the cuts on the femur, and that's robotic total knee arthroplasty using the Mako Stryker system. Thank you.
So that's a brief introduction to robotic surgery. It's always great to have a visual, when we're explaining that. But those analogies are very accurate. So the grass cutting and the electric dog fence are very, very good. It's very safe. So when we're working on a big knee or even a small knee, we don't have to be worried about the exposure because the robot and the software knows exactly where that anatomy is. So it's another level of precision and safety. So stay tuned for another show on robotic orthopedic total knee replacement. We'll be right back. Welcome back to the Dr. Meade Show. This is Meade's favorite videos, and I have a bunch of videos that I use as educational videos, but I said these are so good, it's worth doing a whole show on. So as a reminder, I'm working for Lehigh Valley Health Network. I'm an orthopedic surgeon. I limit my practice to knee surgery. We work from Allentown to Lehighton to Hazleton to the Wyoming Valley. We have patients coming to us not only from all over Pennsylvania, all over the country, and we have people coming from, believe it or not, Asia, Europe, and so Lehigh Valley has a great reputation, and I'm proud to be part of them. So let me move on to a couple videos. A lot of people will ask a question: can you run after you have a knee replacement? And we have a couple different answers, and I'll address some of those. But let me show you what one of my patients brought me most recently. Sit back and enjoy this video.
So I'm here with Dave Huff, a very interesting patient of mine. That time goes so quick, Dave. 8 years ago, he came in. He had an interesting history, and I'll just review it real briefly. He did so many things in his career. He grew up in the military. His dad was in the Air Force. He worked at Mack Truck. He did physical work, worked on cement. And then you take a guy at 42 who gets his third career and went back to school, I guess, for
7 years to get my
7 years.
bachelor's degree.
Got his bachelor's degree. Then he's teaching advanced AP calculus at one of the finest public schools around here, Parkland High School. So that was 8 years ago. We had bad knees. We operated on one knee. You can see a scar over here. We took out a popliteal cyst, took out some bone spurs. Still not enough. Ultimately went to need the 2 knee replacements. Back then we did it simultaneously at the same time. We've advanced now where we do it as an outpatient. We only do one at a time, but the history is fascinating. But anyway, Dave did great until he sort of fell on his farm loading a trailer on a tractor a couple months ago. Just came in to get it checked out, which we just did, and everything looks like the day we put it in. But interesting, he brought in a schematic, and I just want to review what does this schematic indicate, Dave?
13 months after we had the knee replacement, on October 7th, I took a personal day and I decided to run my own personal marathon. So I got on the Ironton Rail Trail at 6 a.m. and at 26.21 miles, I stopped and took a screenshot of the business for the marathon, but I ended up ultimately doing
Yes.
27.4. It took some time. It was more than a walk, but
Yeah.
a good jog.
Yeah, good for
But
you.
I accomplished that 13 months after having both knees
Yeah,
replaced.
and that's a great pace, you know. Long distance running, I guess, is something a lot of knee replacements do, but it is capable of doing that. And you're no worse for the wear. Looking at your ex, and you ran in high school, is that correct?
Yeah.
Out in Oklahoma.
Oklahoma.
Correct. So from a quality of life standpoint, how did this change your life compared to what you had before the surgery?
It was tough. I mean, my knees would always swell. I'd have to sit down a lot. I couldn't do anything. I had no flexibility. And when we did the surgery, it was like young again. I mean, I could bend my knee back where my calf touches my thigh. Everything I wanted to do, I could do. It was just changed my life.
It's great.
It did.
It's great. And even since then, I mean, every year I would say it's like the new Ford F-150, the new iPhone. Every year things come out.
Yeah.
But this is a great testament to these are great knees, 8 years out, and now you're physical in retirement. You have a farm locally.
Yeah, and I didn't want to be that retirement where you just sit in a chair. So we planned to do this at that time so that I could have life after.
And you're on narcotics before that. You
Oh,
weren't
yes.
at all. How about
For
now?
over a year, nothing.
Nothing.
And I stopped taking those. I stopped taking everything about 6 weeks after we had the surgery.
Great. How far do they bend up? Can you bend those knees up? Yeah. How about the other one?
The other one.
All right. I'm going to ask you to stand up for a second. Can you stand up? Can you get on your toes? Now, this is always scary. Can you hop up and down like you're jumping rope?
Yeah.
All right. It was great to see you. We never lose track. I'm going to have Cheryl put you on our research protocol. We'll call you with surveys.
I'm still doing those.
You're awesome.
I'm still doing those from when she set them up for both knees the first
Great.
time.
Super. So great to see you, and I appreciate the feedback. A lot of our patients love to see when they want to look in the crystal ball and see what it's like down the road. So I really appreciate the feedback.
Well, I was proud of this and I wanted to share it with you.
Thank you so much.
I love when patients come in, we're part of their life. If you come into my office and I'm behind, this is why I'm behind, because I like to spend time seeing people's lives, being part of their life. It's very important to me, and this is very touching to me to see this sort of thing. But I want to make one thing clear. I don't want people coming into my office wanting a knee replacement so they could run marathons. That is not really the norm. Can you run with a knee replacement? Yes. But I'll tell you, when people say, can I run? I say, they're your knees. You could do what you want. It's analogous to if you buy a Corvette, and as you drive out of the shop, you say, can I drive this off-road? And the mechanic pauses and he goes, it's your car, you can do whatever you want. But you know what? I'm proud that he's smart. He's not running 100 miles a week. This was a bucket list thing for him to do. He was riding on the rails to trails. And you know, I'm so proud that he accomplished this. And you can run, but again, our goal is when we do these knees that are often in computer simulators now with mechanical properties that can last well over 20 years, to last as long as they can and get you through your life. So I just want to be clear on that. But this was a nice video that I thought you would enjoy. Let me move on and talk about another type of patient. So again, across the country, maybe 20% of knee replacements are done as an outpatient, meaning they go home the same day. Not 23 hours, I mean the same day. But that means 80% of patients are still in the hospital. And patients will come in and believe it or not, most of them don't want to be in the hospital, but some of them, 60, 70, 80, 90 years old, they can have a cardiac issue and they say, well, you know, I need to be in a hospital. And I say, well, really, all we want to do is assess your risk up front. And that's what we use the cardiologist for. We don't use the word clearance. What we use is we want their cardiologist to give us a risk profile. And once we have that risk, then we could talk to the patient about the risk of the procedure in their individual medical situations. And then we make an informed decision between the both of us. And so we have that data. And so here's a patient that came in. He had a stent placement. He had 2 stents placement. He had a pacemaker, and he had a defibrillator in. And he was concerned about having an outpatient joint replacement. Well, we talked to his cardiologist, and you know, there are predictive analytics that we put him in a computer. His risk, because all of his cardiac indices was basically normal, so he could have it done as an outpatient. And he was golfing several weeks after the surgery. So let me get his opinion of his procedure.
So I have Warren Hart here, 75,000-mile retired salesman, avid golfer. You know, we did his other knee a couple years ago when we weren't allowed to do Medicare patients as an outpatient. So now he's a veteran, but we did this knee 7 weeks ago. So we put him into a rapid recovery outpatient total knee resurfacing program. In the interim, he had a little cardiac event, nothing serious, but it required putting a stent in there. And then they put a pacemaker defibrillator. So my point is pre-operatively, we just optimized their medical condition. He's cleared by his cardiologist and his family practitioner. So again, if you are not sick, you don't have to be in a hospital. And we know hospitals, you know, can be bad places for infection and medical errors. Did you have any hesitancy in going home the same day after this knee replacement?
I did not.
Why not?
Well, you said I'd be fine.
So you were confident with that?
Oh yeah, and you explained the system of that at Coordinated Health. You don't do COVID. You know, you do
Right.
orthopedic people. You don't treat sick people. You don't treat other.
Great.
Other,
Yeah, so it wasn't a tertiary
areas.
hospital. We didn't have COVID sick
Correct.
patients. So, and again, we do your own therapy for the first week, and then we see you back. But it's not like the old days where we do 3 days of therapy a week for 3 to 6 months. So how did you do from a therapy standpoint afterwards?
Well, after doing what was required at home, and I wasn't a great patient there, but I did them.
Okay.
And then when I came in for a visit, they said, you tried a therapy, and it went pretty easy. So I figured, okay, they scheduled me for 4 visits, and then she said, what about 2 more? I said, well, okay, 2 more, and just for cautionary purposes. And then I missed one. She scolded me, and I came for the last one, and then she said, I don't think you need to come back.
That was it?
Yeah.
So 5 total visits?
Yeah.
Straighten out your leg for me. Great. Bend it all the way back. Awesome. So he is 7 weeks. We're going to graduate him today. We'll keep track of him on our research protocol. He was swinging a golf club and a golf simulator. How about your next golf match? When are you planning to golf?
I'm scheduled to play on Thursday the 14th.
So he's going to golf really a little short of 8 weeks after the surgery, which is pretty amazing. Last question, how did you do narcotic pain-wise? Did you need many narcotics?
I did not use any narcotics. I stick to the Tylenol, Advil protocol that you guys set me up on the max doses for
Right.
3 times a day.
And how was your pain the first week?
It wasn't severe.
Yeah. So the first day or two, the block works, and then we warn people it wears off the 3rd and 4th day. Half the people never take a narcotic pain pill like you.
Yeah. The second night was the worst.
And we try to warn people
Yeah.
about that, and we preempt it, but still not bad enough to require a narcotic
No,
pain pill.
I have to admit I got close, but I said, no,
Yeah.
never mind.
You're a tough guy.
Yeah.
Hey, thanks for the information. Other patients will appreciate your feedback.
I appreciate you, Doc.
Okay. Take care.
Thanks for joining me on Meade's Favorite Videos. Hopefully we can do another show, and join us next time on one of our favorite shows coming up on robotic knee surgery. Have a good night. Thanks for joining us.